Presentations, may I request all participants to kindly follow a few simple guidelines. Please keep your microphones muted unless you are asked to speak. Ensure your camera remains on during your presentation. Kindly speak slowly and clearly so that viewers are able to understand what you are saying more clearly. Your cooperation will be appreciated. Let us now begin the most exciting part of today's conference, hearing the voices of our young thinkers. Our first speaker is Syeda Fatima Zehra from Mama Parsi School, Karachi.
Sick because we lack cures. We are sick because we doubt them. Let me repeat that. We are not sick because we lack cures. We are sick because we doubt them. Distinguished guests and fellow students, a very good morning to all of you. That sentence sounds wrong. It sounds confusing, but that is exactly why it's correct. Let us address the tip of the iceberg by talking about Pakistan. Ladies and gentlemen, a few months ago, a vaccine was introduced to protect young girls from cervical cancer, a life-saving vaccine. But what happened? Over 3,000 parents refused it. Schools shut their doors. Healthcare workers were turned away. Why? Because of a foolish rumor that this vaccine would make young girls infertile. A lie, proven false by the World Health Organization, yet this lie spread much faster than the truth. But perhaps, ladies and gentlemen, we shouldn't be surprised, because this is something that we've witnessed during the COVID-19 pandemic era. While scientists were developing vaccines in record time, most of us were developing something else. Garlic water, turmeric milk, every desi totka imaginable. Now, don't get me wrong. A good immune-boosting home remedy is great, but it can never replace a vaccine shot like most of us like to believe. And this is not just about Pakistan. In the early 2000s, when there was an Ebola outbreak in Africa, over 2,000 fatalities were recorded not because of the virus itself, but because people started to drink Dettol antiseptic liquid mixed with water, thinking it would kill the bacteria present within them. So think about this. Healthcare and help was knocking on their doors, but fear kept that door shut. Ladies and gentlemen, from one continent to the other, the pattern remains the same. Science provides solutions and doubt blocks them. And perhaps this is the exact reason why our beloved Pakistan is still one of the last countries where polio exists. A disease wiped out globally still stands in our country, not because we don't have vaccinations, not because we don't have awareness, but because people refuse it. So my question to you, dear audience, is that, is the real virus polio, or is it the virus of misinformation? Ladies and gentlemen, our theme for today being, together with health, stand with science, but how can we stand with either of those two when we don't even stand with facts? And as young people, we are not just observers of this problem, we are active contributors to it. Every time one of us forwards something on WhatsApp or Instagram without thinking, we become major participants in this pandemic of spreading misinformation. However, ladies and gentlemen, here is one crucial aspect that most of us love to ignore. Pakistan is not, God forbid, in terms of failure or failing. We have done it all before. Our beloved country has almost wiped out the fatal disease of hepatitis through vaccination and awareness. Pakistan hosts the world's largest volunteer-run ambulance network, for which Mr. Abdul even received Asia's most prestigious prize. The Hamdard Foundation Pakistan facilitates over 500,000 people in terms of healthcare. So no, this is not a story of, God forbid, failure. This is a story of potential, being held back by doubt. So, ladies and gentlemen, we all must understand this. In the modern world, healthcare is not an individual attribute. One person's decision can affect us all. One rumor can put thousands of lives at stake. So my purpose to stand here is not to deliver a mere speech. It is to challenge you. So the next time you see something on the internet and mark it as fishy, ask yourself, is this evidence or is this fear? The next time you flag something as misinformation, ask yourself whether you will stop it or spread it. Dear audience, the future of healthcare globally and in Pakistan doesn't just lie in the hands of hospitals alone. It starts in conversations, classrooms, conferences like the one we're attending today, and in the choices we make. So let me repeat something I said at the very beginning. We are not sick because we lack cures. We are sick because we doubt them. And ladies and gentlemen, the moment we stop doubting what can save us, we will keep needing what we already have. Thank you.
Thank you, Fatma.